Monday morning to the Gary Sutton Show here on WSBA, the last day to sign up for Obamacare unless you fit into a couple of categories. We'll talk about that in just a moment. By the way, I also wanted to let you know at facebook.com/910WSBA, we like to put up segments of our show that we think will be interesting to you. And we had two from Friday, one with Michael Gear, president of the Pennsylvania Family Institute. If you didn't get a chance to hear this, absolutely great thing on the moral underpinnings of the country. And Michael, always so eloquent. And we have that up on the website now. And by the way, our website works. Okay, that's one of the nice things about it. But at facebook.com/910WSBA. And also Randy Edsel, the head coach at the University of Maryland, originally from Glen Rock, Pennsylvania, who had some very interesting thoughts about that whole unionizing of college athletes. I think it's going on with Northwestern right now. He was on with us for about a half an hour on Friday, and that is also up at facebook.com/910WSBA. So get a chance. If you missed it, read it. If you hear it, and if you did not get a chance before, hear it. But if you did and you want to hear it again, there it is, okay? Also, I'm on Twitter at Gary G. Sutton. I did send out that very important story this morning about controlling methane gases, and we'll touch on that a little bit later on this morning at 11:35. But with us this morning is Mike Kahley, who is Obamacare Health Care Expert. He's been with us before, and we welcome Mike back to the show. Mike, great to have you on again.
Hey, thanks again for having me, Gary.
Busy day for a lot of people, I guess. I saw, Thursday, they had 6 million signed up and counting. I heard yesterday that they're now up to 7 million. Although a little thing happened last night. They had the thing shut down, I guess, healthcare.gov. Now, I've got it up here, but it looks like it's back up again now. So where are we now? It's the final day, kind of. Where do we stand at this moment?
Well, I think we stand somewhere between 5.5 and 7 million people who have applied for health insurance through the public exchanges, either federally operated or state-based. And we still have yet to determine who has enrolled, in other words, what kind of demographic mix we have and who's actually paid their premium. But it is very difficult to deny that there's been a huge push from a public relations and media standpoint to get folks to not procrastinate any further than normal and to go ahead and get access on the site to try and enroll.
Mike, one of the things I like about the way you present things is it's objective. We want to look at it on its face this morning. Again, as much as we can take politics out of it, we try to.
Sure.
But the president, along with Kathleen Sebelius, said last week that the benefits of the reform law are already evident and they're projected to grow over time. And I wanted to get your reaction to this particular statement. They point to a slowed growth in healthcare spending, which bolsters the nation's balance sheet. Have you seen that slowed growth in healthcare spending? And if so, what is the reason for that right now?
Well, I have not seen a slowed growth in health insurance spending, either in the anecdotes I see from an individual perspective, and I haven't seen it based on the employers that I consult with. We still have a heavily weighted inflationary environment in the health insurance marketplace. I think what the administration tends to focus on is the out-of-pocket expenses for an individual, and it could be true that there's a slowing in health spend if the federal government is subsidizing a larger portion of the premium,
right,
or employers are subsidizing a larger portion of the premium. So it's not necessarily an inaccurate statement. It's just it requires probably a little bit deeper dive into who are we seeing a slower increase in cost.
Well, what they say is the law's demands for less waste and incentives for health outcomes rather than medical procedures are just now rippling through hospitals and physicians' practices and from insurance companies to executive suites. Your thoughts on that statement?
I don't know that we've had enough time for those things to really take hold. And I'll give you an example. The website, healthcare.gov, is reported early or late in the fall, doesn't have the ability to charge additional premium for those that are smokers. And so many of the key aspects that we might associate with wellness haven't had enough time to really trickle down for us to measure appropriately. And there are certain elements that were planned into this that we haven't been able to articulate because the website didn't accommodate it. So I think it would be more responsible for us to look at whether or not these the impact of preventive care included in every policy, or the impact of certain wellness provisions being provided to everybody else who has gotten insurance. It's probably a year's worth of experience to review that would be a little bit more responsible.
Mike, if the health, let's take a look at the health care for the ACA Act. If the ACA Act is a machine, How is this machine supposed to operate? How is the fuel supposed to go through the pipelines to get the motor started to make sure it operates efficiently?
The fuel for this is this large enrollment effort that started back in October and is now concluding today or April 15th, depending upon your relative struggles in the marketplace. And if the country, get enough people enrolled and the right people enrolled, then the insurance companies can make the appropriate margin or cover the appropriate risk, and that we can start. The hope is that we can start to stabilize some of the costs of healthcare over time. So this jumpstart is really the engine to try and get this working. That then trickles down next year into employers having to meet their responsibilities for affordable and qualified plans, and that will hopefully increase the roles of people who are insured, whether they've been handled through the public or through the private marketplace.
Now, there are a lot of ands there, so I want to go back and pick up on those because obviously the fuel could get tinged a little bit here if not done correctly. I read over the weekend where 4 of 5 people so far that have signed up are getting some kind of government help. They're getting some kind of money, which is one of the things that was part of the plan. If that's the case, if 4 out of 5 people are getting some kind of subsidy, what does that then require in the other part of this machine called Affordable Care Act to happen?
Okay, so you raise an interesting point here, Gary, and that is that the cost of care isn't just what the individual has to pay for. So those are the premium. It comes in 2 components: what the individual pays, and then what the federal government is subsidizing, or what the taxpayer has to pay.
Correct.
And so one of the interesting economic aspects of this law, which we'll have to watch really closely over the next couple of years, is if the individual buying the product is insulated from the overall cost of the product, then we aren't really going to be controlling those expenses, and so we won't be able to subsidize as much without raising taxes or increasing penalties.
Now, it also requires then that you said the right kinds of people in your statement earlier about the fuel that runs this. The right kinds of people. What does that mean?
Well, it really is an allusion to the fact that we need a large percentage of the population that enrolls in insurance to either not incur claims or not be prone to incur those claims. So when we miss our targets for that really interesting 18 to 34 demographic, where I think as of March 1st there was a projection that 25% of the people enrolling in the exchange were in that age demographic. Well, we projected that number, the country projected the number needed to be 33% of the total enrollment in order to have the right risk profile. So it's nice that we're going to hit maybe 6 or 7 million people, but in insurance it's never about how many, it's always about who.
Now, you have a lot of people who were switched over to Medicaid who before were not eligible for, were eligible for it, maybe didn't know it. You have a lot of people on the older end, as you might expect, who are signing up. And so, again, that millennial group you're talking about, the 18 to 34s, the young invincibles, as they're called, we have to have enough of those people paying for a product that they're not going to use right now to help people who are either paying or not paying for a product right now that they're going to receive at this moment. Am I right on that? That's
exactly right. Yeah, you have to have the right mixture of people who, in order to create the right risk environment. And if we're not pricing it based on the right assumptions, then there are a couple of things that have to happen. Either insurance companies increase the premiums, and those can be projected. They're projected right now based on the enrollments to be somewhere between 2 and 3 times their current premium. Or the carriers decide I can't make any money based on these economic factors, so they drop out of the exchange. Or the government has to bail them out through what are called risk corridors to help make sure that the underwriting of the pool of people that enrolled in the exchanges is sound. So one of those 3 things has to happen.
We're talking with Mike Kahley, our Obamacare Health Care Expert this morning. And Mike, so you look at this then, and for these young people, and again, you're hearing a lot of claims over the weekend. Well, they're signing up now. They waited till the last minute. They're jumping in there now. But what happens if we find out here in the next week or so? Because I know the clamor is going to start tomorrow, if not tonight about 12:01. Okay, what are the numbers here that signed up? Let's suppose we don't get those numbers signed up. Let's suppose we don't get the 33% of young people signing up. Let's say maybe we even get to 30. Let's say we get to 30. We'll be optimistic here. What then must happen in order to make up the difference?
Insurance companies in 2015 will have to raise rates because the risk assumptions that they made were not correct. They will do that, or they'll drop out of the health insurance exchange, recognizing they can't make the money that they expected to make, or the federal government will have to subsidize the insurance companies with these risk corridors, and that will only happen through 2016. So long term, we've got a huge tidal wave of premium pressure coming that will carry us only through the 2016 year.
So in other words, we're either going to have to subsidize it, again, with more taxes, or the insurance company is going to drop out, which then I think narrows the choices again a little bit, does it not? Yeah. Which then, the more you narrow the choices, would it be fair to say maybe the higher the rates go, or is that an unfair statement?
The more narrow the choices, the less competition. This would be the hypothesis.
I'm just using Economics 101 here.
Yes, less competition would drive the prices up because, again, there are less insurance companies to spread all of the bad and good risk over. And what we've seen in states where pre-existing condition limitations were eliminated as an example, New York did this several years ago, is that as the premiums continue to increase, the young or those that don't use the insurance no longer value the premium that they're having to pay, and they drop out at a disproportionate rate. So you have this compounding problem of premium expanding and expanding with fewer people to try and lessen that burden.
So today we get, let's say we get 7 million people who have signed up today, and or are in the process of signing up, and over the next couple of days they'll do that, and we have some date out in the middle of April somewhere, we're not quite sure where that is yet, where people have to be signed up by. So now you take that. So the next step then is, okay, if you're the insurance company, you now must collect premiums, right, to put that thing in force?
Yes.
Now,
go ahead.
What happens then if, let's suppose, people start to realize now maybe the reality of it, or maybe they'll all like it, who knows? But if they realize the reality of it, maybe the reality of it is, geez, I signed up for something here, I really don't know if I can afford this. What happens?
Well, if it's very similar to what happens in car insurance or homeowners insurance. If you don't pay your premium, your coverage lapses.
Yep.
So if individuals decide, gosh, for a variety of reasons, this no longer meets my needs, it's not affordable, or I don't like the doctor mix, or gosh, I thought these hospitals were going to be a part of the program, well then, if they drop out, then it's reasonable to assume that those would not be people who have immediate medical needs. So you just compound this problem of the healthy people or the young people dropping out of the program, and those that are using the system staying in, which again compounds the pricing pressure.
Is there any worry by the people in your industry that this might happen on a large scale at all?
Yes, there's absolutely a concern about it. As a matter of fact, Moody's, which is an independent rating agency, just lowered its outlook on insurance companies from stable to negative, which is a significant thing, based on the unstable and evolving environment. That was the quote from the change. So the industry, insurance companies in particular, are nervous about it. This is why the risk corridor was a part of the program to begin with, and the rating agencies are concerned about it as well.
We're going to come back. I want to talk a little bit more about this, Mike, but I want to ask you when we come back, so the penalty, do you think that it will be carried out? Is there a sense that maybe it won't be? Some more questions about Obamacare. Mike Kahley, our special guest here this morning. He is an Obamacare Health Care Expert, as you can hear, and he'll be right back with us here on the Gary Sutton Show on News Radio 910 WSBA. Welcome back to the Gary Sutton Show. We're with Mike Kahley this morning, who is our Obamacare insurance healthcare expert right now. Mike, one of the things I was reading about here, the penalty for not having insurance levied through the Internal Revenue Service at tax time in 2015 would be $95 or 1% of income, whichever is higher. A lot of people thought it was just $95, but it's 1% of your income, whichever is higher. And I guess a lot of people are still waiting to see if the government is even going to invoke that this year. What's your sense of all that?
My sense is that the administration has left the door open for a little bit of interpretation, I think, as part of a way to protect, and again, I know we're trying to stay away from the politics of this,
right.
But it's really hard in this instance to do that, to protect Democrats in particular who are in a little bit of disarray as it relates to their November upcoming elections. And so there are actually 14 different hardships that individuals can claim for not having health insurance. And the latest is if anyone experienced a hardship in enrolling in insurance during this open enrollment period. And I don't think that there's anybody really that can't claim that, especially when you don't ask for any substantiation.
Exactly.
So that is one of the things. The penalty and those hardship exemptions really were more focused on those on the higher end of the wage scale. Mm-hmm. And so those that were probably going to have to pay a penalty for not having coverage are I do believe that the IRS will be applying that to the 1040s for this tax year.
When you look at the three plans right now, and we did see on Friday, Democrats, some of those that you mentioned there or alluded to, who are a little worried, were proposing something called a copper plan. I guess we have, bronze, gold, and silver, if I'm not mistaken.
Right.
So on those three plans, in all those cases pretty much, the deductibles are fairly high, are they not?
Yes.
Now, again, if you're getting subsidies, obviously to help you pay for your plan, that's good. In essence, if the subsidies, if the deductibles are so high, don't you, in essence, not have insurance until you meet the deductible?
That is absolutely accurate. And so the copper plan is really just a way to try and drive down the premium.
Right.
For those that may not qualify for a subsidy, as an example, by taking on, let's say, a $10,000 deductible instead of a $5,000 deductible.
Right.
So that would be more of an approach to try and help those people who had insurance that they liked but no longer met the requirements, and so the insurance companies couldn't honor it anymore. It's really an extension to try and help those people.
So in other words, you get what you pay for at that particular point.
Sure do, yeah.
Now, I also saw where insurers are going to have to decide, obviously, based on their experience this year, how they'll price policies in 2015. And Health and Human Services Secretary Sebelius was up before the House Ways and Means Committee this past month, or this month, actually. Today's the last day. Yeah. She actually conceded finally in testimony that insurance prices may well rise next year based on how the insurance industry sees this thing being carried out this year. So one must then ask the question, how do you define affordable?
It means different things to different people, doesn't it, Gary?
Yes, it does. It does.
And I think that given your locale, there are a couple different things I'd be concerned with. One is in Pennsylvania, you got roughly 350,000 people that by the 1st of March had completed an application to be on the exchange, and only 45% of those had actually enrolled. And so the projections about what insurance will cost in Pennsylvania will be reflective of who enrolls in Pennsylvania, not a reflection of what happens in the rest of the country. Maryland, your neighbors to the south, are going to be in a much deeper quandary in that they only, during the same time frame through March 1st, had 51,000 people roughly who had applied for enrollment in the exchange, and only 38,000 had actually enrolled. So imagine the dollars that have been spent promoting the exchange, building the exchange, setting up the insurance, both from a public and an insurance company perspective, for a meager, what may end up being 60,000 individuals in Maryland.
Wow. I saw a situation on Friday on the news, and then we have about 2 minutes left here, where a lady was complaining that she did not qualify for Obamacare. She was paying for $15,000 a year is what she made, but she also went to the doctor and found out that she'd been taken off Medicaid because she no longer qualified for that there appears to be some kind of falling through the cracks kind of situation here. Are you aware of that at all?
Absolutely, yeah. So this was the part that was actually declared unconstitutional by the Supreme Court 2 years ago now, and when that is that the states cannot be compelled to expand Medicaid, and so Pennsylvania has decided not to expand its Medicaid eligibility where Maryland has. So those people that are between 100% of the federal poverty level and 133% of the federal poverty level, so on an individual basis roughly between $11,000 and $15,500 in income, they don't qualify for a subsidy on the exchange, and they don't qualify for Medicaid in Pennsylvania. So they are absolutely lost.
So now I understand those people also do not get penalized right now, but they also are stuck then. And she ended up going to some group that provides like emergency service, something along that line. Mm-hmm. But what do you tell those people? There was something. The number that was thrown around the other night, and I can't say if it was just for Pennsylvania or for around the country. 400,000 people was a number that was thrown out the other night in this report that I was watching.
Sure, it is a sizable number of folks, and one can argue these were some of the large part of the population that we were trying to benefit through the Affordable Care Act, and they are, in effect, caught in a donut hole where they don't qualify for health reform subsidies, and they don't qualify for state-based coverage, so for them, the Affordable Care Act has done nothing, and they will continue to access services through emergency or through county services, which will continue to put premium pressure on private health plans.
Mike, I hope we continue to tap your knowledge as we go forward here, and the next questions get answered along the way that we've raised today. Thank you so much for your insights and your expertise.
My pleasure. Thanks again.
Appreciate it. Mike Kahley with us here this morning on the Gary Sutton Show, our Obamacare Health Care Expert.